Some people believe that GLP-1 is a cheating. What are your thoughts?
So weight loss medications, in my opinion, are another tool in our toolbox. In addition to all the pillars of lifestyle, nutrition, exercise, proper sleep, managing stress, avoiding risky substances, and so forth, they are another tool that we have access to. And obesity is a chronic disease, and just like hypertension, for example, high blood pressure, if we cannot get the pressure down by adjusting lifestyle, and there's just some underlying genetic or physiologic reason, or they can't make the lifestyle changes sufficiently, we're going to use blood pressure medication. And there is no, this is not a bad thing to do. In fact, it's a good thing in the sense that we need to get that blood pressure under control because we know the kinds of things that high blood pressure can lead to. And it's the same thing with obesity. For a variety of satiety and hunger hormone dysregulations that go with obesity that I've gotten into on other videos, it's not a matter of willpower. Once somebody gets to a significant weight, it becomes a physiologic problem. And if we can't move the needle with just lifestyle, which is very hard, only 10% of people can do that, then we use a medication. And I think it's perfectly reasonable, appropriate, and good medical practice to use a medicine when we can't get where we want to go just by modifying lifestyle. So long story short, I don't think it's cheating. I think it's utilizing all the tools at our disposal.
Is it for everyone?
No, they're not for everyone. There are certain groups of people where they're medically contraindicated to use. Some people might not tolerate some of the gastrointestinal side effects that go with slowing down gastric emptying, one of the ways the medicines work. And not everybody will respond to any particular medication. So they're not for everybody. Some people should never be started on them, and they don't work for some people or they don't tolerate them. But for people who are appropriate candidates, they can be really, really effective, and they can sometimes even help us make the lifestyle changes when we've controlled their food chatter and their hunger and so forth. They can then select better foods to eat, for example.
So what is your process? Like, okay, you get a patient and what do you do first?
Well, first of all, I want to get a pretty thorough history of how they have been challenged with weight over time, what they've tried in the past, what hasn't worked in the past. And of course, I need a full picture of their other medical problems. Are there other things like polycystic ovarian syndrome in a woman that might be complicating the issue, menopause for a woman, obstructive sleep apnea in men or women, lots of other things to consider when we're trying to look at weight. It's not just the number on the scale and we want to throw medicine at it. There could be other reasons that they're having trouble with their weight. Thyroid problems are another one. So I check labs, I get into the history thoroughly, I do body composition analysis. Just because somebody might have obesity in terms of their body mass index, but that's only a ratio of their height and weight. So if they're heavily muscled, they may not actually need to lose too much weight, lose too much adipose tissue fat. So a lot of factors to consider. History, other medical problems, other medications. Some medications cause weight gain, and their body composition analysis plus blood work before we develop a comprehensive weight management plan.
So what are your thoughts? There are a lot of opportunities and possibilities. You can even purchase right now weight management medication for $99 online.
Mm-hmm.
Like, it seems like you have such a thorough approach. You need medical history, you need lab work. Like, what are your thoughts about all this weight management, accessible and compound?
So some of these, not to disparage my other colleagues in the weight management field, but there are practices online where you have very minimal clinical supervision over what's being done. Some of it may actually be AI driven, and supposedly there's somebody overseeing that somewhere in the background. But there was a study done recently showing that a large proportion of these online weight management companies, that there isn't any direct clinical interaction with the patient. So I find that to be concerning. I do think there's really no substitute for somebody trained in obesity medicine to see you in person. There's a place for telehealth. And if it's your only way to have accessibility, I think it's okay. But I would prefer that to actually be with somebody properly trained and not just somebody watching AI in the background. In terms of your question about the medicine itself, as my viewers probably know already, I'm only in support of using FDA-approved weight loss medications that have been thoroughly vetted for safety, efficacy, and purity, and they have to adhere to those standards. Compounded medicines, not necessarily so. You don't know what you're getting, basically. So I don't advise people to use compounded weight loss medication.
So many insurance companies do not cover weight management, and in this case, it becomes extremely expensive. It's $1,200, $1,300, especially when you get to the medium or higher doses. What are your recommendations in that sense? No, not everybody can afford those prices.
Of course, that's a concern. Let me just say, first of all, going directly through Eli Lilly, Novo Nordisk, who are the manufacturers of Mounjaro and Zepbound and Ozempic and Wegovy, respectively, prices have come down. That used to be that's the full list price, if you will. But now we're getting more toward the $400 to $500 per month range. And for some of the lower doses, as you mentioned, it's even less, more like $300. These prices are always changing, and I think they're going to continue to come down, especially as new weight loss medications are FDA approved and become available to the public. However, these injectable medicines, while very effective for most people and probably more powerful on average, there are oral medicines that we have used for years prior to the advent of semaglutide and tirzepatide that can be used even in generic form if you take the two combination medicines and prescribe them separately. And even if you prescribe them as the branded weight management medicine, Contrave, for example, they're not nearly as expensive as the injectable ones. So while cost is always a consideration, there are lots of options to help patients afford these medicines.
In a safe way.
In a safe way with someone who's properly trained in obesity medicine, yes.
Thank you, Dr. Berger. That is very helpful.
My pleasure. So if you'd like to reach out to us and learn how we could help you, we're Northeast Medical Practice in Great Neck, New York. Our phone number, 516-604-3418. Online at northeastmedicalpractice.com. Bear in mind that everything we share here is for educational purposes only. No doctor-patient relationship has been formed, and if you have particular questions or concerns about your health, please don't hesitate to reach out to your healthcare professionals. But until we see each other next time, which I hope is soon, be in good health.
Thank you.